It's Dr. Epley here as we look into the right shoulder now. You can see the anatomy. Here's your biceps tendon. That's that cord right there. That looks really great. Rotator cuff is right up above us here. This tendon right there. That's the supraspinatus tendon. The ball, the humeral head's above to the right. The socket's down here below. And you can see where the labrum is at the top of the shoulder. The superior labrum is this tissue right here. Attaches to the edge of the socket, and that's all fine. See our little shaver coming in here, and we'll and look at the cartilage now on the joint. Up at the front here is where it's torn. You can see the front edge of the glenoid, the socket, the labrum is actually torn off here. This is some of the cartilage on the surface of the joint, and the labrum tear is way down over here. You can see this is where that's where it's torn, and it pulled way down off to the side. And what that allows to happen now is the humeral head, the ball is above it, will slide right out of the socket now as we push forward. You can see the bruising on the back of the ball there right above, and that's where there's been a little damage to the cartilage. Not too bad, but this is the shoulder in the joint here, and this is with it dislocated like that. You can see the divot, pretty good sized divot actually in the back of the humeral head. You can see right there. The capsule, the ligament around the joint is fairly large. That's that yellowish tissue, and all the way down to the bottom into the armpit area, and then around to the back. We're going to tighten that capsule somewhat, make sure you have a nice stable shoulder. And we're going to look at the amount of inferior draw. We can pull this shoulder down. It goes right off the bottom edge of the socket as well. So we need to tighten that up a bit for you. We'll look at the posterior labrum, make sure that's okay. Back here, they see there's the labrum. It's right up on the rim. You can see it in contrast to the front where there's no labrum there at all. And so we'll show you once we get this all stabilized.